Um, Hello, Sharon. I'm Dr. Ben Meisel. I'm a pediatrician and I'm the medical director for California Children's Services, San Francisco. But I am speaking with you right now from a personal standpoint, just as a community member and a pediatrician in the community, but not speaking for the public health department or anything like that. More just wanting to be available to talk about COVID-19 and the children and families that I'm hoping to serve.
Can you begin by telling us a little bit about kind of the health conditions or the health conditions of the children that you work with? Just giving us kind of a general picture and maybe talking a little bit about risk factors for this particular population.
Sure. So the group of kids that I'm dedicated to serving are primarily low-income children with medical complexity, and that includes kids with orthopedic conditions all the way to kids who've had heart transplants and are ventilator dependent at home. And so it's a wide range of children, primarily kids who need pediatric subspecialty physician care. So it's a small subgroup of kids with medical needs, but it's the ones with most complex needs. Many of them are technology dependent, like they have tracheostomies or need help with breathing at home. They might actually need private duty nursing services to come into the home, which is very tricky right now, given that you don't want somebody who's exposed to COVID-19, like a healthcare worker who's coming into your home if you try to keep your home a safe place for a child who has an immune system that might be compromised or has a fragile respiratory tract. The kids who are most at risk if they were to get COVID-19 are just similar to the adult population, kids with unstable airways, kids with severe cardiac disease, children who are immunosuppressed from, let's say, their post-transplant. They've had liver transplants or kidney transplants or heart transplants, and others like that. Kids who are fragile in if they were to get ill with the virus just from a respiratory standpoint, it could be dangerous to them. Or what we're seeing is an immune response to the virus, which actually ends up possibly attacking one's own body. And so further down the line, weeks after having the actual illness, one's immune system may be dangerous and can cause problems with the heart, the kidney, blood clotting, all kinds of things that seem to be associated with COVID-19.
So these children are fragile in some ways and more vulnerable even in non-pandemic times. But based on everything that you're saying, talk about what is at stake for them in this pandemic. I'm wondering even about like their social conditions. Are they able to, like kind of what are all the barriers and obstacles that this particular population is facing as they're trying to maintain their regular care? And also I'm thinking of the social emotional piece that children across the world actually are grappling with right now. I imagine this population is extra vulnerable in that regard as well.
Yes. Yeah, so for all children right now, social emotional learning is really disrupted. And for children with complex medical needs, their whole families exist within a very intricate web of services. And just like in a spider web, if you touch one part of the web or affect one part of the web, the rest of the web moves, right? And things change. And what we're seeing is a real disruption in funding for many of the services that are being offered to these kids. Anything from hospital services where maybe they're discouraged from going to the hospital because they might be exposed to COVID-19 by simply showing up in healthcare settings, all the way to and the hospital is decreasing their census, so trying to maintain some amount of availability to the community in case of surge situations. So discouraging people from coming in. For these kids, sometimes that's a critical challenge, right? If they don't show up for care, then they can get more debilitated. Kids who require physical and occupational therapy, for example, are having to get that over Zoom instead of in person. And so there are children who are forming contractures and having challenges with they're going backwards in their progress with being able to walk and get around. So these are challenges for these kids. Other things that I'm seeing as a result of, let's say, nonprofits or funding sources that are redistributing their funds more towards people in need away from disability. We're seeing those organizations that serve children with disabilities lose their funding. And as a result, this is making the kids even further isolated, and we're seeing we're seeing a lot of hunger and food insecurity and housing insecurity in the general population, but in families whose children have disabilities, this is even more critical. And when we think of housing insecurity in particular, if someone who's receiving public housing, if they lose their housing or if they're not placed in housing that's appropriate for their child who has a wheelchair, or so let's say it's got a long set of stairs, or there's no room for the wheelchair or for the equipment like a stander or a walker, things like that. These are critical pieces to any family with housing needs who has a child with special equipment needs. This has just been very, very difficult for those families who find themselves out of work or needing nursing services at home, but now the nurses have been deployed, let's say, for COVID-19, or the healthcare workers have been deployed. So all of the services that they've come to rely on have fallen away, or many have. And so there are a lot of very tired parents out there and extended families who are trying to support these children and their parents. But it has been incredibly difficult for these families. And speaking about support services, many of them get their support services through schools. So even though in some ways opening schools is a tricky situation, especially for the older children who can transmit COVID a little bit more, many of the services that children, vulnerable populations get really happen through the schools. And the schools have been so important, those communities that have been able to pull their schools together to offer support services to all children at risk. It's been life-saving. And I'm hoping that schools will continue to be able to open in limited ways, but to continue to open as much as possible, keeping everybody safe.
Great. And I'm going to zero in on some questions around that in a minute, and the social political landscape combined with your public health lens that you might be able to also share with us. But you mentioned something right now. You said some of the older children might be able to spread the virus a little bit more easily. Can you talk about that? I've heard that mentioned before, and I wonder if you could say why that is, and what do people mean when they say that?
Sounds good. There are ACE receptors in the nasal and respiratory tract, lower respiratory tract, which is how COVID gets into the cells in the body. And in younger kids under 8 years of age, there are very few of these receptors. And in kids who, as they get older, they become much more like adults and have more of these receptors, making them more likely to get infected with COVID-19. And so for middle school and high school students, the risk of them transmitting the virus, like getting sick with the virus and then transmitting the virus to other students and more importantly, other adults and their teachers at the school increases significantly. So, so the American Academy of Pediatrics and other people who are advocating for schools to reopen strongly recommend schools to reopen for children in the grade school age, up through 5th or 6th grade. But as you get older, there's a more careful opening strategy that needs to be discussed because of this risk of transmitting the virus being closer to adult rates. And so in general, the risk of transmitting the virus in schools has normally been from actually the teachers down to the kids, or between teachers, like in the teachers' lounge, or teachers who are not wearing masks, and that the by improving the ventilation in the schools, by maintaining physical distance in the schools, by having plexiglass up in front of the teachers if they want that, and using masking and hand sanitation, they've been able to reduce the amount of transmission in schools. And in San Francisco, for those schools that have opened, there have been very, very few cases at this point.
So when did you say the American Pediatrics Academy?
American Academy of Pediatrics.
Okay, American Academy of Pediatrics. So when this group is advocating for the reopening of schools, does it mean on a hybrid level? Does it mean having some sort of, a tiered approach? Or is it just kind of, President Trump was saying in the summer, just like open up all schools right now by fall? What's your understanding of the American Academy of Pediatrics position on that?
Yeah, so pediatricians really are pushing the public health message, which is that children's health depends on schools being open, and that poverty is increasing as businesses fail, and as people become more unemployed, and with hunger on the rise, and people being displaced out of their homes, and all the challenges that come with a recession. Schools are a critical lifeline for children and their health. And so what pediatricians are advocating, especially through the AAP, is an evidence-based approach to opening schools as much as possible. And that includes following through very carefully on all of these, on wearing masks, on the physical distancing, on sanitation in the schools, knowing how to use the bathrooms and how and frequent cleaning and those kinds of things. In addition to that, recommending smaller class sizes. So in order to actually be able to follow through on maintaining, let's say, limited cohorts, making sure that kids aren't just connecting with each other at random, but instead being able to limit that that random amount of interaction, so that if somebody does get sick, you can just close down or do contact precautions with the specific kids and families who have had contact with that positive case, as opposed to shutting down the whole school. They can just shut down a small part of the school, or even one classroom, or even certain kids within that classroom. and make sure that they get testing. And there's a whole testing protocol that's being recommended where teachers are getting regular testing so that they can be monitored for any cases that do occur. It's much harder to have the kids do that. Number one, because of the limited number of tests that are available, but there's also the challenge of getting results in a timely way and reporting results to the school as opposed to the family, and determining who's going to be ordering those tests. It gets very, very complicated. So what they're recommending through the American Academy of Pediatrics is a testing regimen, particularly with the staff, to maintain safety amongst the staff, but then to test those kids who are symptomatic, and to determine which symptoms make a child symptomatic, especially at this time when runny nose and cough is something that comes with a lot of viruses. And so it's difficult to know who to test and who not to test. And so that's what we're looking to the public health experts and infectious disease experts to let us, to guide us on that.
That's helpful. And I think if you talk about the masking plus the social distancing plus the need for smaller cohorts, that shows kind of why the hybrid would be the natural kind of first step as opposed to having everybody come back. So that's very helpful. And you, I'm going to ask you kind of a multidimensional question as well. So you are a parent of 2 teenagers and you're a medical health practitioner, a doctor, and you work with very vulnerable populations, and we're living in a pandemic. We have not had a consistent, there's not been consistent federal leadership on this. In fact, we haven't heard from President Trump at all recently. How frustrating has that been for you, or what has your experience been of kind of the lack of the piecemeal approach that we seem to have in our whole country? And what are you hoping for as we move forward?
It's really depressing and unsettling to look at, to know what the potential is for us to pull together as a nation and do this in a coordinated way. Unfortunately, every state has been left to do it on their own, in their own way, and that different approach between states leaves neighboring states more vulnerable, or more the cause of disease spread, and so from a healthcare standpoint, I mean, it's been really, really sad, and to see that this surge really has been unnecessary. That you can look at other countries and other examples. In fact, certain parts of this country have been able to maintain disease levels at a very low level by simply following these simple public health guides. These guidances like the masking, like the physical distancing, like limiting your contact to just a few other families, and having a pact with one another that you won't be exposing yourself to people whose exposure to COVID-19 you don't know. These practices really do decrease the transmission of the disease, and even on top of that, to know that by wearing masks, you decrease the amount of disease, the amount of virus that you might get inoculated with if you do get infected. There are researchers at UCSF who are showing that the amount of virus that you get infected with actually determines the severity of the disease that you get. So wearing a mask can actually decrease how severe the disease may be if you do get it. So it has been really upsetting and challenging to watch so many different approaches to either battling the disease or deciding not to. It's left us with one of the greatest public health crises that the world has ever seen right here in the United States, with over 300,000 people and probably more, those who haven't been counted and those who haven't been able to actually get health care at hospitals in an urgent way, because all of those hospital beds are taken up by people who have COVID-19 instead. So
I
it's
want to
been
zero
upsetting.
in on something that you just said, which is that, because it's talked about and then people say, I wear my mask for you, but you just suggested something that I've been hearing a little bit more about, where by wearing your mask, you're not only protecting others, but you're giving yourself an added layer of protection. Is that what you just said?
Oh, absolutely. So wearing one's mask not only protects the people you love, but it also really does protect you. And these people who say that it's not, why should I wear a mask? It is a really confusing thing for me to hear, given that we are finding that by reducing the amount of virus you're exposed to or that you get infected with, decreases the severity of the disease that you may get. That they really are. There's a physician at UCSF, Monica Gandhi, who's doing this research, and it's been really important in proving and showing to people that wearing masks does protect you as well as the people who are around you.
Yeah, I just wanted to take a minute to really amplify that, because I don't think we talk about that quite enough. And on this note, what do you say to the people who have taken an anti-masking position? It's almost become, it's very interesting from my vantage point. It almost looked like you could tell what political party you were in based on whether or not you chose to wear a mask. And then there's also the rhetoric about, this is my right and you can't infringe on my right. If I don't want to wear a mask, I don't have to wear a mask. How do you respond to, maybe you haven't had to respond, but I'm going to ask you to respond now. What would you say to some of these people, or to the people who have that kind of my rights are my choice and you can't tell me what to do, that frame of mind?
I would just say, that your freedom and my freedom are caught up in one another, and that when you decide not to protect yourself from this virus, and if you get infected, then it could infect the people around you, even without you knowing, given that 40 to 60% of people who get the virus and can transmit it are asymptomatic or pre-symptomatic. And so when you say you're not going to wear a mask, it actually is a threat to me, and to those people who are around you. So I plead with you to reconsider, because it actually is probably the cause of the spread of this virus so significantly in this country, and it's the cause of so many deaths, and so it's not about freedom at this point. It's about caring for one another and not seeing each other as different tribes within the United States. Like, we're all Americans here, and we're all human beings and should protect one another. And we've done it before as part of, coming together to serve in wars and to battle challenges as a nation, and we need to come together again in the same way today, because COVID-19 doesn't care whether you wear a mask or not. It's going to get you sick, and we can protect one another and ourselves by simply putting a mask on, the way that a carpenter puts a mask on when they're protecting themselves from sawdust.
I love that analogy. Two more things I want you to comment on before I let you go here. One is the holiday season is upon us. We are deep in the purple here in the Bay Area, and yet today they announced that 85 million people will be traveling by air this holiday season. What public health messages would you like to remind people of as we enter the holiday season?
I was part of a meeting last week that estimates that all of the beds, all the ICU beds in California will be filled by December 24th. This is the biggest reason I can think of to please don't gather with people whose contact with COVID-19 you don't know. If you're going to gather, keep those gatherings extremely limited, just to that one family you've been spending time with, during this stay-at-home order and sheltering in place. I would, strongly recommend if you are going to be traveling at all, there are quarantine recommendations. If you travel out of state, if you travel across counties, if you want to protect your loved ones and protect your community, after you've traveled and you come back home, please quarantine in place for 10 to 14 days so that you know whether you've been exposed or that you might become symptomatic with the disease. It is so critical for us to be able to maintain our hospitals function, that we're available at the hospitals to care for people who come in with strokes and heart attacks and regular health needs. If we are all getting sick and our beds are being filled in the hospitals such that there's no room for other care, we're going to see a lot of deaths, not just from COVID-19, but from the diseases that can't get care, that need to get care in the hospital. So please stay home, connect with people virtually if you can, talk on the phone, and have small gatherings using masks, not putting food out as a smorgasbord, but instead, have the food being served by one person. Don't pass the food around. Try to stay away from each other while you're eating, even though you can talk, but maintain that physical distancing. It's inside homes, inside small closed spaces without good ventilation. That's where people are getting sick. And that's why we're trying to keep the message to don't have big family gatherings at this time, because it will kill people.
Thank you. And on that grim note, the vaccination, it's arriving, and a lot of people are getting. Are you going to be getting the vaccination, or have you already?
Well, at one of the responses to COVID-19 has been for my program to decrease the number of in-person visits with the kids who need physical and occupational therapy, and that's where I have been seeing children in person. But because I have pulled away from doing in-person visits and I'm just doing virtual clinics, I'm sort of second rung for getting the vaccine, and I'm in complete support of that, given that the amount of vaccine that has arrived is more limited than what we were hoping initially. So the people who should be getting that vaccine right now are the people who are actually taking care of COVID-19 patients in the hospital, taking care of people in skilled nursing facilities, and who are at highest risk for not only getting COVID-19, but transmitting it to vulnerable populations. So I'm hoping that I'm going to get the vaccine as soon as possible. Both of the mRNA vaccines look amazing and with few side effects and highly effective. So I'm hoping to get that vaccine, and once I do, hopefully in the end of January or February, that once I've got both doses, that I'll get to start seeing kids in person again, and I'm hoping that will help their families become a little bit less isolated.
And finally, it sounds like I can't promise finally, you never know, there might be one more thing that will come up, but for this round of vaccines, or at this particular moment in time, it looks like the vaccine is not yet available for children under the age of 16. I wondered if you wanted to weigh in on that or share your thoughts.
The vaccine hasn't been studied in children under 16. And so there's not a lot that I can say about whether, whether it's effective or safe, or whether children should be getting the vaccine at this point. People who know about the vaccine and who have looked at the vaccine think that it really, there is no reason for it not to be safe in children under 16. However, there is some concern about something called MIS-C, which is a condition that can happen in children after being infected with COVID-19. Weeks or months after being infected, they can get an autoimmune response that almost a vasculitis that can occur and cause multi-system challenges with very few children. It's a rare it's a rare condition that can occur after COVID-19 in children. The two vaccines that are currently available, they aren't an actual infection with a live virus. So unless the spike protein, which is what the vaccine is helping us to produce an immune response to, the spike protein, we don't know whether that is a cause of this MIS-C disease later in children. We don't think so, but it is possible. So until there's more testing in children, we won't know, or not testing, but until more children get the vaccine and we can see whether there are any cases of MIS-C, we won't know if that is from being exposed to the spike protein or being exposed to the actual virus itself. And so at this point, there's no way to recommend the vaccine in children because there haven't been very many children to receive it.
That feels like a very safe approach, right? Better to wait until we have science. So on that note, are there any final messages that you'd like to share with the listeners related to statistics or any news briefings you've gotten today or things that are on your mind as we go into the holiday season? You talked about kind of the public health message, but anything else you want to leave us with?
One thing that COVID-19 has really shown us is that people can pull together to create a, here, let me try this again. So one thing that COVID-19 has shown us is that people can really come together and make a big difference in creating safety for one another when we're faced with a challenge like this, an unknown that we learn about as we're building the system to protect ourselves. And one of the other challenges that we're seeing is how fragile some of our public health networks are in supporting the most vulnerable populations. Those people who live in close settings with multiple family members and can't do physical distancing where they live, or those families who are living from paycheck to paycheck, or have unstable housing, or who have to show up at work and be close to other people, that we, for the children I serve, for kids with medical complexity, I've seen how dependent they are on community-based organizations that depend on philanthropic funding, and how important it is for us to create a better healthcare system, one that won't fall apart when we have pandemic response, and when people who have insurance are able to be protected so much more than people without insurance, and how people who are more vulnerable, when they get sick, it gets everybody sick. And we're all dependent upon each other's health. And so it's really important for us to build a stronger healthcare system that doesn't depend on wealth or depend on where you live, how you live, but that is there when we need it, regardless of our social situation.
Yeah, it does seem like being in a pandemic does illustrate some value for a single payer system, perhaps, or a system which doesn't link our ability to be insured to our employment. It does seem like that might be the case. Is that in part what you're like pondering in your last remarks?
Yeah, I mean, I would love someday to see a baseline coverage for everybody, so that, you know, citizens and non-citizens alike, if you are sick and you're in this country, you potentially expose other people to that illness. And in order to keep the country functioning, we need to have a baseline of support for people in healthcare, so that people aren't afraid to go to the doctor or to go to the hospital or to get care if they need it. And that way we can keep each other safe, and we can keep pandemics from ballooning out of control like this one has.
Yes, I hope that we don't have another pandemic anytime soon. And then lastly, the mask will be a part of our foreseeable future, do you think? It seems like the vaccination is not going to be the magic bullet that's going to take away the mask immediately. Is that your understanding as well?
Right. So there are lots of vaccines in development, and these first two are just the first two of several. And the first two happen to have very high efficacy, right? 90 to 95% of people will be protected from COVID-19, it looks like. But that leaves 5% of people who could still get it even after getting the vaccine. So for a long time, we're going to have to wear masks until we have something called herd immunity, where at least 60 to 70% of all people in the United States have gotten the vaccine or have had the COVID-19 infection, so that we have a far less chance of getting of having COVID-19, the actual infection, in the community, to the extent that we can feel comfortable taking our masks away. So it's going to take some time for that number of people to actually either get sick or to get the vaccine. And we actually don't know how long the vaccine will provide coverage for us. So the hope is that this one vaccination will cover people for years, but we don't know that. And until we actually know how long people will be protected by the vaccine or protected by actually having had the infection, we're going to need to still wear masks when we're in group situations and when the likelihood of transmission is increased. So yeah, I think we're going to be with masks for a little bit longer for sure.
We have a new normal.
New normal. Yeah.
Well, Dr. Ben Meisel, thank you so much for taking time to be with us today, and we'll be in touch.
It's my honor. Thank you for asking me to talk today.
All right. Thank you. Take good care.
Thank you, Sharon. Bye-bye.
Bye.